Hi there. The intended learning outcomes of this video are for the students to be able to differentiate the various payment models used by Medicare to reimburse healthcare providers and to discuss the implications of each model on cost and quality. There are various models of payment that Medicare uses to pay healthcare providers. The three main models are fee for service, capitation, and bundled payments. In addition, Medicare pays providers based on the number of days and reasonable cost. Other models of payment we will discuss today that are rarely used by Medicare are global budget and salaries. The first model we will discuss is the fee for service model, the traditional model of payment. In this model, healthcare providers are paid a fee for each particular service provided. This model rewards providers for the volume and quantity of services provided, regardless of the outcome. Medicare predominantly uses the fee for service model to pay for hospital outpatient services, for physicians and dentist services, for laboratories, for medical equipment and supplies, for outpatient therapy, for ambulance services, and for drugs. The fee for service model is inefficient. It incentivizes providers to do more service units like tests, procedures, visits than necessary to increase revenue. The capitation model is a model of payment in which the providers receive a fixed amount of money per enrollee or per beneficiary. This amount is paid in advance for a defined period of time, whether the member seeks care or not, regardless of the member seeking care or not. Medicare permanently pays managed care organizations using the capitation model of payment. The capitation model rewards providers for reducing the cost of treating patients, which many insist that it leads to cost reduction practices that can hinder the quality of services. These cost reduction practices with, may include withholding necessary services, limiting the use of expensive tests and drugs, relying on generic drugs, shortening lengths of hospital stays, increasing waiting time, shortening outpatient visit duration, restricting patient choices, and discharging patients to cheaper post-acute care settings. The third model of payment is the bundled payments model, or payment per episode. This model is considered a middle ground between fee-for-service and capitation. Under bundled payments model, providers are paid a fixed amount based on expected costs for clinically defined episodes of care. Medicare uses the bundled payment model predominantly to pay for hospital inpatient services, home health services, services of long-term care hospitals, and services of rehabilitation facilities. Another payment model used by Medicare to pay providers is the per diem payment model. Under this payment model, providers are paid a flat per diem rate that covers all patient care aspects. Medicare uses the per diem payment model to pay nursing facilities, nursing homes, psychiatric hospitals, ambulatory surgical centers, and hospices. This model incentivizes the providers to prolong the length of stay and to minimize the use of expensive resources. The last model of payment used by Medicare is paying providers based on reasonable costs. This model is only used to pay certain hospitals like the critical access hospitals, which are predominantly rural, small hospitals, and specific government-owned providers. Those are paid paid those are paid on the basis of reasonable costs. Two other payment models rarely used by Medicare are the global budget, or payment per year. Global budgets are a payment model in which providers, typically hospitals, are paid a set, fixed amount for the services they provide. Providers are responsible for ensuring that patients or enrollees receive all required health services. The Veterans Health Administration operates a hospital system that distributes global budgets to its hospitals. Global budget is a form of capitation. Salary is the last model to be discussed. Salary continues to be the dominant method of physician compensation, though the percentage of individual physicians' income derived from salary varies greatly by practice setting and medical specialty. Salaried physicians and non-physician providers are paid for the time they work. These are the references. Thank you.